A city in Massachusetts is considering a $500 fee for lift assist calls, as well as raising their transport rates. I'm Greg Friese. I'm a paramedic, an educator, and a runner. I'm joined by my friend Joel.
Hi, I'm Joel Neild. I'm a registered mental health counselor intern and a paramedic and a former firefighter.
Thanks, Joel, for joining me in this discussion. As a paramedic working in the field, you and I have been on lots of lift assist calls. I've always taken the approach that I'm there to do the job. I'm uncertain oftentimes about what it's actually going to cost the patient. Do you think it changes the way that I might provide service if I know that the patient or the skilled nursing facility where they live is going to see a bill for $500 for me helping them off the ground and into a chair or a bed?
I think that changes the way paramedics approach the service they're giving. I didn't do a lot of lift assists in these skilled nursing facilities. I understand in the article says that the staff is generally told to not lift them up and allow the first responders to come and do that. I don't know where that comes from in their policy, if they want them assessed before helping them up. But I don't think that changes how I would approach the patient themselves. Anytime we approach someone who has fallen, we always check them out, make sure they're okay, make sure they don't need a hospital, and make sure nothing hurts before we pick them up and help them get back to where they want to be. So I don't see that changing me.
Do you think it helps a paramedic and a firefighter mentally in their self-identity when they know what their time is worth?
I don't think that field paramedics and your firefighters think about their job in that way, to having absolute value attached to it. I think it does help them maybe feel a little better that all these constant runs we're going out to nursing homes for lift assists, maybe that'll reduce the number of calls, because sometimes if you're doing that a lot, it can feel like a nuisance to the responders.
I've heard that verbalized quite a bit. If we're doing a lift assist, that means we're not available for a potential emergency. And it seems like, at least on social media, that really weighs on people. They have all this training and these skills and a lot of expensive equipment. But when we're doing lift assists, especially when nursing home facilities like, hey, we don't do that, I think that does drag on people. If somebody's having a set of feelings or find they're complaining to their family, their peers about that, how would you advise them to process that emotions about maybe their worth or their capability?
Yeah, that's a really great question. We see a lot of burnout in emergency services for these, I'm going to call them nuisance calls. I don't think they're all nuisance calls, but these repetitive things we do over and over again that seem like they're a waste of the training that I've been through. Some of that comes from that. I feel like I'm too well trained to be doing this, but in reality, our jobs are public service jobs. So if you're feeling that way and it's really weighing on you, then it's really time to maybe talk to a professional about that. A therapist can help you find and refine the love for the job that you had and maybe take a different lens through it. Because we all have the people in the districts we've worked in that call us for, I fell down. Maybe rather than just complaining about it, we also have ways to say, okay, well, what needs are not being met here? Can we bring in home health aides? Can we get a social worker here to really assess what this patient needs? So I would suggest talking to someone about that, a licensed professional.
I've had a colleague that said the cure for compassion fatigue is compassion and giving compassion to others and helping solve whatever the underlying problem is. That could be really satisfying and become a real professional milestone. I think it's worth considering a fee for lift assists. I'd also encourage people to make sure you're communicating with those facilities and say, hey, can we help solve whatever the underlying problem is? Is it policy, staff training? You have equipment, but you don't know how to use it. You need equipment. Joel, your final thought on this news story?
I think that's really the way to go about it. I'm okay with fees for service because especially smaller towns and volunteer departments, they have to fund themselves some way. But also there is how do we solve this problem? What do these facilities need? So there's working with the people in the community and the skilled nursing facilities to say, how can we make this better for everybody?
Hey, Joel, where can people find you if they want to learn more about you?
You can find me at my website. It's joelneild.com.